Hello there. Today, the topic that I will be discussing is burnout in healthcare employees. It's a very common issue for healthcare employees, and there are steps that we can take to prevent burnout. So, first, let me define burnout. Burnout syndrome is common in medical professionals because their work is taxing mentally, physically, and emotionally. In addition, healthcare policies do change frequently because of the nature of healthcare and patient safety. And work as a healthcare professional can be high stakes, so that provides a lot of stress for healthcare professionals. The most highly affected healthcare professional of burnout is nurses. This is followed by physicians and then uh, other support staff. So let's get to the definition of burnout syndrome. Burnout syndrome is characterized by increasing anger, frustration, suspicion, and paranoia regarding colleagues' influences on one's own personal career ambitions, excessive rigidity and inflexibility in practice, and the appearance of characteristics of one who suffers from depression. This comes from the source Bridgman, and Barone, which I have listed as a reference. In addition to this definition, there are phases of burnout. There are three phases. The first phase is emotional exhaustion, followed by depersonalization and cynicism. And third is decreased senses of personal accomplishments. This again comes from Bridgman, and Barone, as well as Montero and Martin et al. So let me discuss some more details about these three phases. Emotional exhaustion includes feelings of apathy, indifference, and a feeling of an inability to help others. This is obviously very negative for healthcare professionals as their job is primarily helping others and making them feel healthier. The second phase, depersonalization and cynicism, results in negative attitudes towards work and feelings of detachment. Once again, this is not beneficial for healthcare professionals. And finally, decreased sense of personal accomplishments. This results in feelings of inadequacy, incompetence, and decreased work productivity. A healthcare worker may feel that no matter what they do, it is not enough and there's always more work to be done. That's a quote taken from Bridgman, and Barone again. Um, but basically, a healthcare professional may feel that they are unable to help their patients or feel that their care is inadequate. There are methods of measuring burnout. The like most commonly used method is the Maslach burnout inventory, which has 22 inventory items and takes approximately 15 minutes to complete. Um, in addition to that, just analyzing an employee's behavior informally and looking at the symptoms that I just described can be one way of determining if an employee is experiencing burnout symptoms. And employees can do this for themselves as well, as long as they know these burnout symptoms. Excuse me. There are many factors that contribute to burnout. I'm going to go through a couple of them now and the ways that they affect employees and burnout. So, workloads can contribute to burnout syndrome if the workload that an employee has been given exceeds their human limitations, has strict requirements, limits a worker's time to rest and recover between work events. So that is how workload can contribute to burnout. In addition, feelings of lack of control can contribute to burnout. Um, the worker, this happens when a worker experiences role conflict or confusion and doesn't know their exact role in the organization, or there is general poor guidance in the workplace. Reward systems can contribute to burnout when they do not provide sufficient awards or incentives for employees. and do not provide enough recognition for employees doing excellent work. Workplace communities can lead to burnout if there is not a strong level of social support or social interaction, if there's poor conflict resolution in the workplace, or if there's a lack of team building or relationship building that takes place in the workplace. Fairness can lead to burnout when an employee feels that there is a lack of fairness, either by the organization as a whole or by superiors. Values can contribute to burnout if there is a strong difference between an individual employee's values and the organization's values. Job person incongruity occurs when a person is not well suited for their job. This includes skills, abilities, their expectations, or their coping abilities. These could all be incongruent with the needs of their particular position. Another general cause of stress that occurs frequently for healthcare professionals is changes in technology. Changes are constantly being made, and it takes time for employees to learn new technologies, and it also takes time for employees to problem solve with technology if it's not working how it should. So now let's just discuss why this particular issue is important. So whenever healthcare providers are experiencing burnout, they're unable to provide their very best care, and they are more likely to commit medical errors. This is hugely important because this can raise medical costs not only for the patient but for the facility, and also can result in patient injury or death. So it is a very high stakes situation. In addition, high levels of stress can manifest physically in employees. This can lead to health problems such as cardiovascular disease, chronic pain, sleep problems, fatigue, weakened immune systems, and gastrointestinal issues, among others. So if an employee is experiencing these issues, it will make it slightly more difficult for them to care for patients if these are not handled well. In addition, if these conditions become severe, they may require time off work to take care of themselves, which costs company money and time. Psychological effects can also occur if an employee is experiencing burnout. These include depression, anxiety, and substance abuse. These again can become worse and require the employee to take time off to deal with these issues. Employee satisfaction is at the heart of this. If an employee is not satisfied, they'll withdraw. And this, again, takes away from the working environment and is just, it's important to employees and employers because the employee, it will be unsatisfied if they're experiencing high levels of burnout, and the workplace will not run as efficiently because the employee is withdrawing. Lastly, it's just morally correct to address these issues of burnout because I'm sorry, excuse me. They impact the employees so heavily and also the patients that are going to the medical facility seeking care. So now that we know why burnout is such a severe issue, let's discuss some solutions. So in addition to what I've discussed before, there are burnout subtypes, and there are 3 different categories of them. There is the phrenic subtype, the under-challenged subtype, and the worn-out subtype. And understanding the types, these 3 types can help to employers to better tailor programs to meet these needs, the needs of these individual subtypes. So the frenetic subtype is a group of people who are very ambitious and high achievers. Often people in this subtype take on too many responsibilities, but a benefit to this subtype is they do feel high levels of involvement with the organization. The under-challenged subtype feels indifferent and uninterested in the workplace. This means that they're less likely to seek personal growth opportunities and feel bored. And finally, the worn-out subtype feels unacknowledged for their work efforts and feel that the workplace is a chaotic environment where they have little control. Oftentimes, this group neglects additional responsibilities because they feel so worn out and so overwhelmed. So understanding these types and the issues that employees face mentally can help to create programs to help. Another method of combating burnout is through training employees to have self-compassion. This can occur when employees are seeking their degree or when they are in the workplace. Montero Martin et al. Describes self-compassion as being touched by and open to one's own suffering, not avoiding or disconnecting from it, and generating the desire to alleviate one's own suffering and to heal oneself with kindness. There are three dichotomies to this. Three dichotomies to self-compassion. These are self-kindness versus self-judgment, common humanity versus isolation, and mindfulness versus over-identification. So working with employees to become more self-kind, more humane to others, and more mindful can help them reduce their risk for burnout syndrome. To address the specific causes of burnout, I can go through some ways of doing that. So if an employee is experiencing burnout because of overwhelming workloads, the workplace needs to allow that employee to have more time to recover from stressful work events. This means taking breaks or having time off in between big projects or big events. Just having time off is important. Burnout caused by feelings of having little control can be combated by providing workers with clear expectations about their role in the workplace. Reward-based burnout can be managed by altering reward systems to better incentivize and recognize employees' good work. And burnout caused by poor workplace communities can be decreased by promoting social interaction and providing employees time to engage socially with one another. Burnout caused by unfairness can be combated by explaining to employees the reason why certain decisions are being made. Then if there is incongruency between the workers' values and the workplace's values, one source suggests to help the employee better align their personal expectations with organizational goals. But from other sources, they state that it is almost impossible to change employee values or expectations. So it may be better to let the employee either move to a different organization or move to a different position that better suits their personal values. Burnout caused by job-person incongruity can be alleviated by either moving the person to a job that better suits their skills, talents, and abilities, or by training them to be able to better handle their position. And finally, burnout caused by changing technology can be alleviated by informing employees how to use the new technology and giving them time to learn it. Also, to ensure that new technologies do work for the entire system before it is implemented on a large scale, and by giving employees easy access to tech support systems so they don't have to spend a lot of their time on the job trying to problem solve new technologies. Future research, there's plenty of research that can still be done in the area of burnout. Discovery of additional methods of relieving employees' burnout would be very useful. And further tests of current methods and future methods of relieving burnout would also be good in helping to determine which methods are best for which particular situations. And now I'll just run through my references. I referenced the article Burnout, Associated Comorbidities and Coping Strategies in French Community Pharmacies, a BOP study, a nationwide cross-sectional study. This was found in PLOS 1 in volume 12, their 8th issue, their 12th volume, their 8th issue. This was by Baliazak et al. In 2017. I also referenced Whole System Approaches to Improving the Health and Well-Being of Healthcare Workers, a Systematic Review. This was also from the from PLS 1 in Volume 12, Issue 12. This was written by Brand, Kuhn, Fleming, Carroll, Bethel, and Wyatt in 2017. I also referenced American Society of Health System Pharmacists. Forgive me, that's the journal. The article from that journal is Burnout Syndrome Among Healthcare Professionals from Volume 75, Issue 3. This was written by Bridgman, and Barone. Another article I referenced is Healthcare Staff Wellbeing, Burnout and Patient Safety, a Systematic Review. This again was from PLS 1, Volume 11 and Issue 7. This was written by Hall, Johnson, Watt, Tsipa, Tsipa, and O'Connor in 2016. The article Burnout Subtypes and Absence of Self-Compassion in Primary Healthcare Professionals, a Cross-Sectional Study, was also published in PLS 1 in Volume 11 and Issue 6. This was written by Montero, Martin, Zubiaga, Saracita, DeMarzo, and Trenk and Garcia Campayo. Finally, Coping with Occupational Stress and Burnout in Healthcare was published in the Indian Association of Health Research and Welfare, Volume 5, Issue 3, and was written by Sihag and Bidlan in 2014. Thank you very much for listening, and I apologize that I went over time. Thank you.